this tutorial, we are going to look at performing a retrospective chart review in Atlas on data from the Stanford STAR OMOP database. We'll start with looking at defining a cohort or finding a cohort that you want to start with, making a copy of it, and talk a little bit about the Odyssey standard phenotype library. We'll talk about generating that cohort on the database, and then creating reports for that cohort we can look at, and then finally finish with reviewing the history for a single patient from that cohort. So this is the Atlas homepage for the Stanford Odyssey instance. We'll start by going to the Cohort Definitions tab. This is where we can look for cohorts that we're interested in. All of the cohorts that other people create are here, and we can take a look at them and make copies. So I'm going to search for a rheumatoid arthritis cohort. And we've got a few here. These cohorts that start with PL and then some number are cohorts that are defined in the Odyssey standard phenotype library. A large number of these cohorts have been loaded into the Stanford Atlas instance, and so these are good starting points for a cohort definition. In this case, we have a few different variations that might be more sensitive or more specific for the type of phenotype that we're interested in capturing. I'm just going to choose this one. So now we have a text description of how the cohort is defined. We see that we start with a condition occurrence of rheumatoid arthritis, and that this is going to be defined as a concept set. If we go to concept sets, we can see the rheumatoid arthritis concept set, and it's going to be a single concept ID right here. So this is how we're defining rheumatoid arthritis. And then we have some additional criteria: age greater than or equal to 18. And we also require one condition occurrence of rheumatoid arthritis. So we need a second, we need an initial occurrence of rheumatoid arthritis, and then a second one that's at least 180 days after the first one. And then we're also requiring that they have a drug that's defined as DMARD in this concept set. Now, if we want to change this cohort, we can go up here to this copy button, and we can make a copy. So it's a good idea to rename the copy. And then we can change any of these criteria, the concept sets, or anything about this cohort that we want to do. I'm not going to change it. I'm just going to use the existing one. So I'll delete this copy. Let's get back to our cohort. The next thing we're going to do is look at the generation. So this cohort has already been generated on all of the data sets in Atlas. We are most interested in this one, which is the STAR Stanford database. And we can see that we've had 2,000 or so people. To generate, we can just click the generate button, and it will run. And here I'm generating on the 1% database, which is a good idea to do just to make sure your cohort definition works. And this should run fairly quickly. So once we've generated the cohort, we can see the number of people and the number of records. And so this tells us that each person is in the cohort only once. For some cohort definitions, a person can be in the cohort multiple times. They can enter and exit the cohort. Next, we're going to look at the reporting tab, and we'll look at the reports on the STAR database. So this gives us information about the cohort, and here are conditions that are co-occurring with the patients in the cohort. So these patients have rheumatoid arthritis. Clearly, they also oftentimes have hypertension, chronic pain, joint pain. These aren't a surprise. Low back pain. But this kind of helps us characterize the other conditions that patients in this cohort also have. Let's look at drugs. So here we get drugs at different levels of classification. We have the first level ATC classification and fourth level ATC classification, where the first level is going to be the least granular and fourth level is going to be most granular. And this kind of helps us get a sense of what drugs these patients are on. We can also look at a tree map view, and here the size of the block is the prevalence, and the color of the block is the length, is mapped to the length of the era. So this is a continuous period of time that a person is on the drugs. So here we see that many of these patients are on immunosuppressants for a significant period of time. Hydroxychloroquine. So this is a nice view to explore the different drugs that patients in your cohort are taking. Let's look at the person report. I neglected to mention that in order to get to these reports, in addition to generating the cohort, we also need to run this quick analysis. So this usually takes about 10 minutes, but since it was already executed on this cohort, I didn't need to do it. But if it has not been executed on a cohort that you want to explore, you'll need to click this quick analysis button. So the person report gives us a nice histogram of the birth year. We also can see the sex of the patients, male and female. Most of them are female. 57% are white, and 80 or so % are not Hispanic or Latino. Let's look at the procedures. So again, we have the procedures that are most common for these patients. We can see blood draws are a common procedure, regular office visits. You can also view this in a tree map. In this tree map, the color of the box is mapped to how many records there are per person. So in some sense, the intensity of the procedure. Finally, let's look at the tornado plot. So this gives us a breakdown, an age-sex breakdown of the patients. And one neat thing that we can do is click on these icons down at the bottom. If we select a box, we'll get a random sample of 5 patients from our cohort. If we click on one of those, Atlas will open a new tab, and we'll get an individual view of this one particular patient. If you know the patient ID of the patient that you want to look at, you can also search for it here. But this is an easy way to select a random patient from your cohort and review their medical history. So time 0 is going to be the entry point of the cohort. So after this patient had 2 rheumatoid arthritis diagnoses, the time 0 is the entry point when they entered the rheumatoid arthritis cohort, and this is all of the history they have prior to that. We can see it in a table view here, and we can also filter for drugs, visits, conditions, condition eras, measurements, and so on. So this lets us explore a particular patient and do something similar to a retrospective chart review on a random patient from a cohort.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.